Hi everybody, this is a video about Bartonella and calming down neuroinflammation that may manifest as outbursts or OCD type symptoms. Someone posted a question on one of my other videos, and it's a very well worded question, but a little bit lengthy, so I'm just going to kind of paraphrase a little bit and bring on the lengthy questions. It's great. Don't want to spend too much time reading things off because I try to keep these videos kind of short. So basically saying that, is there anything that I have found to be helpful for patients with Bartonella that have neurological symptoms like OCD and outbursts? And outside of maybe psychological interventions or things like DNRS, which is a dynamic neural restructuring system or retraining system. I can't remember what the R stands for. Good question. So I guess it's a good straightforward question. It's a little bit of a complicated topic, but just I'm going to try to break it down into just a couple of, I guess, simple overall thoughts. So one is that, and as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. When it comes to OCD type behaviors and outbursts, or some folks have, as they call them, rages, and that's something that can certainly happen with Bartonella. It can also happen with borreliosis, mycoplasmosis, basically anything that can cause brain inflammation. We can see these types of sort of emotional outbursts, shall we say, or these types of behaviors that might come up. And so really I look at it through the lens of, well, what's causing that inflammation? And of course the infections can cause that. It's always a question, do folks have other things going on too? Do they have viral reactivations? Do they have mold toxicity? Do they have heavy metals or other toxicants that have built up in their system? So I'm sure it goes without saying, because I say it all the time, but I guess I'll say it one more time. We need to make sure that we're treating the root cause factors that are driving that process. But of course that takes time. So in the meantime, what can be done to bring some symptom relief? What can help? So things that help to reduce that inflammation can be helpful. Some folks find benefit from things like fish oil, or sometimes omega-6 essential fatty acids, sometimes working with things that have more of a neurological anti-inflammatory property to them, like Japanese knotweed or Chinese skullcap, these immunomodulating herbs that can help reduce inflammation, things that help to reduce microglial activation, as it's called. Sometimes working with things like PEA or frankincense, or sometimes curcumin can be helpful, not too often in my experience, but sometimes. And then some folks actually really benefit from things that reduce inflammation just in a more like traditional pharmaceutical way, like ibuprofen will sometimes help if we're not concerned about side effects on their stomach or whatnot. Probably don't want to be popping ibuprofen all the time, but it can be helpful during sort of acute bursts of emotion or rages or whatnot, or if the OCD is getting really intense. Depending on the patient and their history, especially if there's Bartonella, there could be mast cell activation, which could of course be caused by other things too. And so sometimes mast cell stabilizers or antihistamines will be helpful. So things like Reactin, which I believe is called Zyrtec in the US, Reactin here in beautiful Canada, or things like quercetin, or again PEA, kind of doubles as mast cell stabilizer and anti-inflammatory. So those are the types of things that can be helpful, and sometimes a low histamine diet can be a helpful component there too. So working with things that are directly anti-inflammatory can be helpful. Now those don't tend to be so much of a, I'm having some emotional outbursts, and I'm just going to pop some curcumin or frankincense or some PEA, and like it's going to settle it right down. I mean, pharmaceuticals like histamine receptor blockers or ibuprofen could potentially help more acutely like that, but a lot of the things I just mentioned would be more like keeping them in place, or getting them in place so that it reduces overall inflammation, so it raises the threshold at which one's going to have OCD symptoms or outbursts or whatnot. In terms of actually antidoting things in the moment, it really varies from patient to patient, of course. There's no one size fits all, and certain people with certain genetic polymorphisms will sometimes actually flare from some of what I'm about to say, but some patients really benefit from working with liposomal GABA. GABA is the most prevalent calming neurotransmitter in the central nervous system, and liposomal GABA can oftentimes work quite quickly. I find it usually works within about 20 minutes, so that can settle things down quite quickly for some folks. Of course, patients might have a prescription for something like Ativan or some other benzodiazepine to try to settle things down, but that's not necessarily something everybody wants to use. Not everybody can tolerate those. Not everybody has a prescription for those. Plus, some of them are addictive, so we have to be careful with those. So GABA is sort of a non-pharmaceutical option that could be considered. There's also this herbal trio formula that I used to use all the time, and then when liposomal GABA came on the market, I found it just worked so well. It was so efficient for many patients. I don't use this other formula as much, but it used to be my go-to. It's a trio of herbs that's called Phytocalm, and it's a lemon balm, California poppy, and motherwort in equal parts. And that's something that has been very, very helpful for patients. So some folks, GABA is great, but it doesn't work for everybody. So the Phytocalm combo can be very helpful. Also, every once in a while, patients will benefit from a combination homeopathic remedies that have an anti-anxiety effect. I find that the effects of homeopathy are really pretty hit and miss in my hands anyways. Some experienced clinicians have totally different results, but I do have some patients where there's this formula from this company called RubyMed called Annex Vita, and I've had dozens of patients over the years who have really, really benefited from that, and oftentimes they're folks who are really sensitive and have a hard time tolerating other treatments, so that Annex Vita formula can be really helpful. So those are some of the thoughts I have around kind of non-behavioral therapy / amygdala retraining interventions to help with outbursts and rage. Oh, but one other thing I definitely wanted to mention, video is going way over time, so what's another few seconds here? Low-dose immunotherapy can be really, really helpful when the right formula is found. When the right formula, if the patient needs it, and we have the right formula that we've identified. And so in the case of Bartonella low-dose immunotherapy can be profoundly beneficial for reducing that nervous system inflammation. And quite frankly, when we find the right dose of low-dose immunotherapy, it oftentimes starts working really quickly, and it can just really help to shut that neuroinflammation down really beautifully, amongst other symptoms too. So thank you for the question. I hope that information was helpful. In this question, there was actually another question, which is another good one, but I'm already at over the 7-minute mark, so I'm blaspheming in social media, the social media world, going this many minutes into a video. So I'll leave it there for now. If anybody has any questions about this topic or anything else, please post in the comment section below, and I will post another video again soon.